Well, hello and welcome to EKU Online's eCast series. And today we have Dr. Shirley O'Brien with us. She is a University Foundation professor at Eastern Kentucky University in occupational science and occupational therapy. And she's recognized as a fellow of the American Occupational Therapy Association. She has a BS in occupational therapy from Temple University, an MS in occupational therapy from Rush University in Chicago, and her PhD from the University of Kentucky in educational policy evaluation. Dr. O'Brien has been a member of the EKU faculty for the past 29 years. She has teaching and research expertise in policy development and leadership, sensory modulation and autism, online learning, and student mentoring. Dr. O'Brien has received numerous service awards for her work in pediatric occupational therapy practice and serves as coordinator of the Faculty Innovators at EKU. She has presented and published on the topics of effective technology use in the classroom, scholarship of teaching and learning, and designing learning environments, along with other disciplinary applications in pediatrics, autism, and transition programming for students with disabilities into college environments, along with COVID-19 applications for teaching and learning. Dr. O'Brien, thank you for being with us. We're so glad to have you with us today.
Thank you, Steve. It's a pleasure to be with you here today.
Oh, great. Well, you are besides all the other things, Dr. O'Brien, you are also the online coordinator for the Occupational Therapy Doctorate Program here at EKU. Now, this online program is consistently rated as one of the best in the country. Can you take a moment and share with us what makes this program so special?
I really think it's the partnership that we have with our faculty, our students in eCampus. We are light years ahead of other institutions. Having the support of eCampus with our recruitment and retention specialists, along with then our instructional designers. I have to throw out a bone for Dr. Stephen Shisley. He makes our courses look phenomenal, and he's there to make sure that the templates are the same so that no matter who's teaching or when the students come in, they get the flow. They build the habits and the routines that one needs for online learning. And then our faculty, the expertise on the EKU faculty is phenomenal too. We have content experts in diversity, policy, leadership, content places, occupation-based practice, research. You bring it in and it just shapes together. And what makes us really unique is that we don't have tracks like other programs. We've decided to organize around the concept of advocacy, leadership, and change in evidence-based practice. So we attract therapists who already have a degree in occupational therapy to then use this information in their clinical practice, being leaders in their area, being able to shape the policy to advance what is needed for their clients and their populations that they work with. So it really is a team effort. There isn't one thing I could point to that makes us so unique. It's the complexity of the way this program was designed.
Well, I know one of the interesting things, or one of the interesting aspects of this is something that I think is near and dear to your heart, the Interdisciplinary Autism Certificate Program. Could you talk about that for just a moment?
Oh, yes. That is within our entry-level program. And collaboratively with Dr. Myra Beth Bundy in psychology, and then special ed and speech-language communication disorders. We have put together an 18-hour certificate program that allows students to work together in our courses, really learning what it means to be a team, particularly for how do you address the individuals with autism that could be on your caseload. So if there's one thing about this program that's really unique, it really prepares our graduates to go out there and work as an interdisciplinary team member and collaborate. for me, collaboration is what it's all about.
Very good. Now, I'm going to ask you probably a silly question here, but what exactly does an occupational therapist do, and how does it differ from physical therapy? Most people are familiar with that term.
Oh, sorry, Steve, I didn't mean to cut you off, but yeah, that's really true, because when you think about occupational therapy, it's like, well, what do you really do? And if I had to say it in a nutshell, we're problem solvers in the getting people to engage in daily life. We use therapeutic use of everyday life occupations such as cooking, bathing, dressing. For school-based practice, it would be learning how to get from class to class, organization, executive functions. And so we work both with people, groups, populations to enhance their participation. And I think most people think of us as rehabilitation professionals, but we're way beyond that. We integrate the mind, the body, and the spirit for what is motivating for one's occupation. And again, when I say occupation, we're not getting people jobs. We're really doing everyday meaningful tasks that's core to our performance and our living. So we use therapeutic use of self, therapeutic use of occupation. One of the things that's kind of cool about this is that for me, this was a way I could play while I still got paid. Have fun with it. It's really a cool profession. So we look at illness, injury, disease, but then we look at the strengths that the individual has. We look at their activity limitation or participation restriction, and then we try to say, okay, how can we get you back to being a homemaker? How can we help you to begin to take over, like getting dressed for yourself? That's a big thing after surgery. There's nothing worse than that, than having to have people wait on you. If you're like me, it's like I want to be as independent as I can.
Mm-hmm.
Same thing happens with children, because my practice has been more with children and youth. Giving them the decision-making properties, to say it's okay. What's important to you? And then what would you like to work on in our sessions? Because, so many times people think of us in the schools as handwriting therapists. Well, there may be ways to have the student work on technology. There may be ways to have the student work more efficiently to build their endurance to get the proper grasp so they can take notes and not be tired like most of us are now in COVID-19. So that's kind of my spiel that I usually talk about with it.
Well, this is kind of interesting. You mentioned several different groups or populations just now. Can you talk a little bit about the diversity of populations that you work with?
Oh, it goes from womb to tomb. We work neonatal intensive care babies. We work with developmentally disabled children. And then, you start to work with troubled adolescents. That's where a lot of my work with Dr. Bundy will overlap. And then you move into that whole idea of the cognitive counseling piece. And then when we think about activity restrictions, you typically think about chronic conditions like a stroke, a traumatic head injury, diabetes. So that we've got to look at energy conservation. We've got to think about how do we build endurance, particularly after a head injury or a stroke. You may have to learn how to use an arm or a leg in order to take care of yourself again. Getting in the bathtub is always a real joy. So how do I stand? How do I pivot? How do I weight shift in order to be able to independently wash myself? I know there are a lot of people that don't like to have assistance in the bathroom. So putting those safety precautions in there. For me, eating is one of my valued occupations, as is cooking. So being able to use both of my hands in order to stabilize the bowl as I'm stirring. I love to bake. Now, I'm not always the greatest baker, but in order to pour that bowl into my loaf pans, having the endurance to do that is an important piece. Then there's the cognitive piece of that. Following a recipe. I have to know that I don't jump from line 1 down to line 5. There are sequences. So with people who have had a head injury or a stroke, and those are the most common ones everyone understands, it's like you'll notice people seem impulsive, so that we may have to look at varying the way the directions are presented for them so they can work and live independently. How's that sound?
Wow, it sounds like a lot.
Yeah. And I didn't even touch gerontology yet. So, again, when I said womb to tomb, working with individuals who have memory loss. We have phenomenal programs through our level 1 fieldwork. We have a place called the Place to Be for Alzheimer's here on campus, and we use that for our on-campus fieldwork programming. It was developed by an OT back in the 80s, Penny Benzing, and it's still going on with our current faculty. That is one of the gems that we can offer back to our community here.
Wow. I mean, I have to admit that I am really blown away by the depth of what you were just talking about, the diversity of not just the population, but the kinds of difficulties that people find themselves in. Just as an aside, how long is the doctorate program? How many semesters is it?
Our post-professional doctoral program is about 2.5 years. So look at 7 semesters. Now, all of the things I'm talking about, these occupational therapists have already been trained in. So they will be coming to us to then advance that knowledge base. For example, the end of our program, we do capstone experiences, and those are guided faculty research opportunities. We just finished with one gal who works in, I want to say, New Jersey, New York, who was looking at transition programs for adolescents. And really, how could she promote more daily living skills so that these kids, as they're leaving school, can go and join society? So building that independence. We had another capstone where the therapist got dementia certified and then went on to run an arts group for memory. Oh my gosh, it was her capstone has the most beautiful artwork within it. And the families were very thankful. And the participants were like, they remembered things from their background. So, she worked on that within the St. Louis area, along with their Visual Arts Council. So lots of fun things that we do.
Well, I'm going to shift gears here a little bit. All of that is fascinating, and I wish we could have the time to delve into it even further. But there's something really interesting about you that I'd like to talk about, and that besides being a professor with a heavy teaching load, and you're the online coordinator, and you're involved in so many other things which consume a great deal of time, you've also been involved quite extensively in university governance. And I just want you, if you would, tell us a little bit about what roles you've served in and what drew you into that particular realm of university life.
Well, as an occupational therapist, I see myself as an advocate. And when you start to think about my doctoral degree in educational policy evaluation and analysis, it really drew me to that idea of what is governance, what is fair, what is just. How can I be more involved? So very early on in my career, I was president of the Kentucky OT Association. I've served the American OT Association as representative from New Jersey, and I live there. I tried to run from Kentucky, but I didn't live here long enough to then flip into that role. And then within the university setting, I have been a graduate coordinator. I've served on lots of cool committees, collaborative committees, and I was really privileged to be elected the Faculty Senate Chair back in, I think it was 15 or 16. I was on the executive board, served 2 terms in there, and I just like to be in the know, because if you're in the know, you then can problem solve for what's coming down the pike. And that's what I like to do to help my college and my department as we're setting goals and initiatives of what opportunities may be there. I also, back in the 90s, received the Lindy Boggs Award from my from the American Occupational Therapy Association for my political activity. I am a political junkie. I'm sorry. And I just love it. I love to see how policy is made, and that I teach the policy class in our post-professional doctorate. I love to understand how can we get involved, and I like to help people understand that, because when you work with populations that are disabled, someone has got to help with that self-determination and helping them to advocate for themselves. So I think, again, we have to be partners in that relationship. So that's my story, so to speak.
That's fascinating. That's you're a very busy person, I know. And again, just want to thank you so much for your time today. I want to congratulate you on being named the Foundation Professor for EKU. Can you talk a little bit about that designation? I mean, what does it entail, or what does it mean exactly?
Well, the Foundation Professor program was developed by Dr. Hanley Funderburk back in the 80s as the highest recognition of teaching excellence at the institution for faculty who chose to stay in a teaching role. And I think that is probably the most important part of that. But it's just not about teaching. It's about how we blend our teaching, our service, and our scholarship. So when I talk about a lot of the things I do, I really see myself as a teacher scholar. And that's different for a faculty member at a regional comprehensive like Eastern or Masters 1 by Carnegie classification. You know, we have high teaching loads. We're busy. We're a service-laden institution, which could be good because faculty do have power. But when you think about that as foundation professors, you know, you have to really have a commitment to putting your students first. It's that teaching responsibility, and that's something I try to do in everything I do. My goal is to be a mentor, to really pass the torch to the next generation. You know, we're not all going to be here, but I want to inspire someone. And so one of the things that came across, I know when I received the award, the committee had talked about my dedication to reaching across to other disciplines. And I started this with talking about the autism certificate. I love working with people who are not in my discipline. I love to see what we can all bring to the table. You know, that's the policy wonky in me. I really like to work with others. It's about collaboration, along with using best practices in teaching. We have got to be evidence-based. And a lot of my teaching, you know, when I go back into thinking about how I incorporate students, is to get student input. I love partnering with students. So when you look at my research, you'll see student names all over there. Most recently, I just got we did a Pedagogicon presentation. Libby Hannon from Residential Life and I, and our 2 GAs did a presentation on developing leadership in students as partners through a program called Kernels Mentoring Kernels. And the OT students are RGAs, and they're helping us co-lead this program, which is a program for children or students with autism who are freshmen here at EKU to help them acclimate, get engaged, because we know from a retention standpoint, if students are engaged from the get-go, we can retain them and we can graduate them.
Wow, that is exciting. I love that collaboration. That's an exciting adventure. I'm going to shift gears here a little bit, Dr. O'Brien, and you've been acknowledged as a faculty innovator for the university, and that in itself is quite an honor. You're known to be an excellent online instructor. So, given the circumstances that we find ourselves in today, what advice do you have for those who are just going into online teaching? I mean, what are some of the essentials that they need to keep in mind when entering into that modality, that world?
Steve, that's a hard question. Because, you know, when you think about it, we have lots of opportunities at EKU. Faculty are also very busy. I think if there was one thing I would say is do the PD1 and PD2s that are offered by the Instructional Design Center. I've been, you know, I have that tendency to just jump in and take on new things. Yeah, I know, surprise, surprise. I was like one of the first people that taught through virtual IV lines because I just thought it would be fun. But through that experience, now what we have, we've got lots of courses. And you have to put the commitment in, but it helps you to understand what tools you have available to you. You don't need to know all of them. I'm a big proponent of small teaching. You know, James Lang's book, and now, oh gosh, I can't think, somebody Flowers did the one for online teaching. You take one thing and you go ahead and try to make it better. So I use a lot of tilt procedures within what I teach. I take one assignment and fix it. But I also collaborate with my instructional designer going, this is what I want to do. What are my options? Right now, Stephen has guided me into Flipgrid. And I've learned to appreciate it. I'm not totally sold, but I'm getting better. But, you know, really looking at the tools, how can I get here? How can I get student engagement? And so that's the collaboration piece where you have to talk and you have to call and say, what can I do with this? But the courses are there if you take the time to do them. So IDC has been just a gift to me, a blessing.
Good. Well, continuing on this thought of online teaching, what has it meant to the faculty and to your students to have the OTD program available completely online? And how do you ensure, this is a question I get asked all the time, but how do you ensure that the rigor and the quality is there?
Well, the first thing, all of our courses go through Quality Matters. And that's a voluntary accreditation review that takes place so that we make sure that content is up to date. We make sure that the accessibility is there. We look for, you know, and I talked about templates. Templates are there. Making sure that we're reaching out to students in multiple ways so they feel like it's just like you and I right now. We're right here virtually. Having open student hours. The students knowing that you're going to have a set time frame of when you're available. Sharing with them what your habits and routines are. You know, like I tell my online students, I do a Friday check-in. My weeks start on Monday, but they're up for preview on Saturday. So, you know, if you want to look ahead, they'll be there. The next week will be there on Saturday. But we start on Monday with the new week. And then by Friday, I'm looking to see at what they're posting on the discussion board, or like I'm using Flipgrid this time. So I'm watching their Flipgrids, trying to get an idea of where they are with the materials they've had to read and watch, and how they're applying it to their clinical practice. And I do a summary check-in video every Friday. They're called Sentiments with Shirley. And it's it's a little cutesy thing, but I always try to get accolades out to a couple folks about, check out Steve's discussion this week. He's got a very different interpretation of what policy is. You might want to give him some comment on that. So I do that, and then I let them also know when I'm going to grade. I will finish grading discussions on Mondays, which means I have to put in my schedule grading time, and I'm very strict. Nothing goes into my Monday time period when I grade. That's my habit and routine. Major assignments, I tell them, I'll probably have them graded by Thursday, because students must have feedback within the week on major assignments, or you get lost in it and they don't know what to do with it. It just becomes a to-do thing. So those are a couple tips of what I think keep us as a cutting-edge program. Students see us as compassionate and caring. And then when students aren't, if something happens, we'll reach out to them. Steve, I noticed you missed all your discussion boards, or you were late on an assignment. Hey, is everything okay? Do we need to meet? We don't embarrass them, we'll reach out. We also do, in our program, we have a student representative to our curriculum committee, and she meets with the students twice a term. So week 3 and week 7 is up to the student rep. And then I come in with an advising meeting, usually about week 5, just to say, hey, how's it going? What are you doing? Anyone want to talk? When we experienced COVID-19 in the spring, what I'd planned for an hour went into 2, just because people needed to reach out and touch someone. They needed to hear that others were experiencing what they were. I know when I've taught in the past, I had one student 2 years ago that hit all 3 hurricanes. So we never knew. She would send an email going, okay, she traveled for her job. She goes, I'm in Florida. I'm hoping I can get out. My discussion board post this week may not be great, but I got to get out before Michael hits. And we just, it became just a nice supportive group. At least that it was in my class that happened. All the students reached out. We have a class lounge where they talk to each other. They post pictures, babies, new jobs. I post about my garden this year, because I got tomatoes, so I'm excited. But that's what I think makes our program credible, unique, and responsive.
That's exciting, because some of the press lately has been kind of knocking what they think is online learning. And I think many don't understand exactly what online learning truly is. And it's not what happened in the spring where we were rapidly trying to put something together. It's a much more planned and deliberate purpose of pedagogy and technology. So,
well, and that's a really good point, Steve, because I think people associate online as being the overall, but online really does have that structure in there. It takes a lot of pre-planning. I'm not going to lie. I work harder in my OTD courses than I do in my face-to-face classes on campus. But what we experienced in the spring was forced remote learning and just throwing everything. And with true online learning, you do a phenomenal job of backward design. What do you want your outcome to be? Then how do you build it forward so that you don't kill the students along the way?
Well, one of the nicest compliments that we continually receive is that through our training sessions about online teaching, our faculty are learning how to become better face-to-face teachers. And we're just thrilled about that, because at the end of the day, for us, it's about pedagogy. I mean, technology's fun, it's shiny, it's new, but what it comes down to is good, solid teaching.
I agree with you. After I did the PD1 and PD2 courses, my teaching evals went up in my face-to-face because I was more deliberate. I really had a plan, and I think that's where my Faculty Innovator role with transparency and learning and teaching, or TILT, comes in. It really allowed me to tilt. I'll tilt as I go, but it allowed me to tilt my assignments to make them more relevant for my students. My instructions were clearer. You know, I tend to ramble, I get excited, and I learned how to put it, just the clarity and relevance really came across stronger after those courses.
Well, we've talked about several things today, but let's say a prospective student came up to you right now and said, Dr. O'Brien, why should I get a doctorate in occupational therapy? And why should I do it online? What would you say to them?
If you want to be a leader in the field, and because you're reaching out, I would say you want to be a leader in the field. You want to advance yourself. You need to think about how you can select a program that will promote your clinical interest while advancing your role in a particular area. If you're looking for a program that will only give you skills, this probably is not the program for you, like to be a better physical disabilities therapist. If you're looking for leadership in physical disabilities, oh baby, we're the program for you. We've got, one of our faculty, Dr. Ann Fleischer, works with breast cancer research. She's phenomenal. She's one of the few in the country, and we're fortunate enough to have her here. I had one student who just said in her entry application, I'm hoping I can work with Dr. Fleischer for my capstone research. So coming in, she can already see what Ann has done. People look at our articles, they look at our Vitas, it's all on the webpage. They say, well, what are these people interested in? How can they help my career? How can they mentor to me? And that, if you want to be a lifelong learner, we're the program for you.
Oh, very good. You got me excited about taking it now.
I think we're going to have to get you an entry-level degree first.
Yes, I think so. Well, tell me, what are some of your alums doing now? Where are they at in the country or in the world? And what are some of the exciting things they're doing?
Well, they're all over the country. We've got some folks working at, I want to say Kaiser Permanente in Los Angeles, running a TBI unit. We have people in academia. Our most recent graduate, Rebecca Mojica, is teaching at Florida International, and she was able to use her capstone project to build patient simulations activities and get some good evidence-based practice research on that. And it really has come in handy for all of us as a result of COVID-19 of how do you use simulation research. We've got other folks, Greg Pitts, who is in the Lexington area, owns Commonwealth Hand and Physical Therapy. He has been a hand therapist, he's certified, has 3, 4, 5 clinics. I lose track, but entrepreneurial leadership, which is really exciting. We have, I'm trying to think of we have some other folks who are in Ohio, working in school-based practice. That's always again, that's near and dear to my heart, but really taking leadership about moving into a related service provider, program coordinator. I think that's an important role because we forget about that whole use of time, that whole use of workload. And that's something that when you only look at a medical model for treatment, for reimbursement, everything is done by minutes. But when you realize it's just like university life, minutes don't really count. It's about that workload perspective of what needs to go in there. So we've got folks all over doing really cool things. So a couple folks working in mental health counseling. And we have a therapist who's out in Arizona. Dr. Angie Gorman is working with sleep studies and correlating that with hand injuries. So kind of like I say, soup to nuts. It depends on your interest, but everybody's working and they stay in touch. It's always fun to hear back from our alums about the great things they're doing. The other thing that I notice when I go to my professional associations nationally, they are presenting along with other colleagues now. So they're being role models. They're passing that torch of how do I share evidence-based practice. So pretty cool.
You know, I thought I knew what OTD really was about, but you've given me an education today. I've learned a great deal about what the program really is about, and your emphasis on leadership and data-driven decision-making and policies and those kinds of things has just been fascinating. I mean, I'm glad that we had this conversation today.
Well, I am too, Steve. Thank you for inviting me.
Yeah, is there anything else, Dr. O'Brien, that you'd like to share with our audience before we call it off here?
If you have questions, if you want to hear more about the program, please reach out to me. I'm easy to find, shirley.o'brien@eku.edu. Look me up. I'm on social media. I'm on Twitter. Just, friend me. I'd love to hear from you. Reach out.
Very good. Well, thank you, Dr. O'Brien, for your time today. And just know how much we appreciate it and how much we appreciate your work here at Eastern Kentucky University. Thank you so much.
Thank you, Steve. It's a pleasure to be here.